Let me actually also give my introduction. My name is Shalini Menon. I am your facilitator for this workshop. I am super grateful that you have chosen to join me this evening or morning, depending on where you are. Please continue to introduce yourself, your name, and the organization that you work with in the chat box. It's a great way for me to read and get a context of where you're coming from. I am going to wait for 30 more seconds and then we'll get started. Perfect. Thank you so much. I want to start by congratulating everyone in the Women Lift Health team for being able to organize and put this together. I've been following so many updates and it looks like so many incredible women leaders are here. And I just couldn't have found a better opportunity to meet all of you. I'm located in Bangalore, India, so it's late evening for me. I'm sure for a lot of you, you're perhaps beginning or ending your day too. Here's something I want us to get started, and I'm sure all of you are aware. I actually have just 45 minutes, and I'm going to steal all the time that I have with you to jump straight into this conversation. I want us to take a moment to recall a time when you had to tell your story publicly, whether it was online or offline. There are two parts to it. One, what was your greatest enabler? And the second part is, what was your first obstacle? Now, I'm fully aware that I might be speaking very fast for some of you, so I'm going to share my screen to make sure that you are able to read my instructions. So if you've already understood my question, please feel free and go ahead and put it in your chat box. I might ask some of you to unmute yourself and talk. And that's largely because I don't want this to be a monologue. I would love for you folks to have a chance to talk and offer your point of views. There are some great introductions there. I'm going to repeat my question. Recall a moment in your personal or your professional life where you had to tell your story online, publicly, online or offline publicly. What was your greatest enabler? What was your first obstacle? So there are two parts to it. So please, maybe if you could think about it and leave your comments in the chat box, I might, read them out loud and maybe even ask some of you to speak. All right, I hope my question was clear. It's on your screen in case that isn't clear for all of you. You could choose one response. You don't have to take both the answers. What was your greatest enabler or what was your first obstacle? Awesome, I have some responses. Thank you so much, Eva, April, for coming in. Eva, my greatest enabler was the passion I had to share my story, hoping it helps someone else. Fantastic. April says, knowing what to focus on, what themes to center, obstacles, interesting. Preeti says, knowing the audience, obstacle, whether the story was long-winded, all right. Sriram, my enablers are my patience. Interesting, they're compelling stories. The obstacle is getting like-minded supporters. Very interesting. Can I request, Sriram, if and I don't know if I'm saying your name right. I apologize if I'm not. If you could actually, take the support offer, tech support, and unmute yourself and say a little bit more about, your patients being enablers for your public storytelling. It'll be great to get some, your voice actually. Can we unmute K. Sriram, please? Sorry if I'm putting you on the spot, but I think that was something very interesting.
Okay, thank you so much for this first for this great program, and I actually joined to learn something from you and from the other participants. But I'm thrilled to be asked to talk about this. So I run an NGO for girls and women. I'm a physician. I'm a specialist in diabetes and endocrinology. But I kind of went the public health route a few years ago, seeing how big, how different and difficult and dismissed the problem of diabetes and NCDs in girls and women, really the problem is. So when I get up to, talk about this, at least in the beginning, it was more like, Usha's doing the usual feminist rara stuff, and she's just talking, they conflated women's rights with women's health.
Mm-hmm.
So they looked at it more like as I'm talking more about equity and things like that, which I am, and gender is a determinant of health, which is what I'm trying to tell people. That it's very important to keep gender as a determinant of health. So when I talk about, because you said in public speaking, so when I present a story of a patient, then everybody, I find that is the most enabling thing, because I could keep talking and they wouldn't be, I think the thing that convinces the most the audience is when I tell them the story of a woman or a family. And in terms of barrier or obstacle, is I'm just saying to get that group around you, because it's very hard to do. It's such a big thing without a big group of people who feel the same way.
Yeah, interesting. Without a group of people who feel the same way. Thank you so much, Dr. Sriram. You could actually just go on mute if you like. I can see that there are a lot of resonating responses in the chat box. Ginger, you talk about greatest enabler being support of other women. And I think that resonates with finding people who actually understand. Shalini, you spoke about being vulnerable as one of the first obstacles, and I totally hear you on that. Julia, you speak about support system, trustworthiness, very interesting. Thank you so much. Fear of being vulnerable and being open. Yep, absolutely. I think we all relate to that. My greatest obstacle, Karen says, wanting to be perfect, wanting to be scientific and correct. Interesting. Karen, may I request you to unmute yourself? And I request our tech support team to mute Sriram and unmute Karen so that I can take a quick, let's actually hear you, Karen.
Hi, thank you. I'm Karen Daniels from South Africa, and I'm a health policy and systems researcher. And my greatest, you asked about a personal story. So I wasn't in a scientific environment. I was in a, let's call it a self-help group, a mutual help group. And I had to share my personal story, but all the obstacles of my training of, this has got to be perfect, it's got to be correct, it's got to be referenced, were in my way, rather than just being authentic. And the person that was supporting me, she said, like I said, you got to get out of the way of your higher power or my higher self. And I needed to let that come through and just, just be authentic and let people see me good and bad, rather than than perfect. And once I did that, I found that people did relate to it, because they weren't looking for perfection. They were looking for real and authenticity. Thanks, Shalini.
Thank you so much, Karen. I think your comment also made me, reminded me of something that is very important in all storytelling, that perfect is the enemy of good. And that's a reminder that a story need not be perfect in so many ways. Thank you so much, Karen, for speaking and placing your voice here. Lots of Marlene used to talk about a lack of confidence. I 100% relate to it, and I'm sure a lot of people in this room do. Jessica speaks of self-belief. Dr. Deepika talks about effectively navigating my story without losing my message. Wow, it's amazing. Great. So in today's session, over the next 30 odd minutes, I have to take you on a journey. And my hope is that irrespective of whether you build skills, I am able to leave you with a perspective. And of course, please feel free to stay connected beyond this session so that we can continue to offer you those perspectives. I'm going to offer you an imaginary situation now. Yeah, I'd like you to read what comes on your screen and tell me, if you were in that situation, what are the first few things that you would do? Here's your first situation. You're about to have a baby. The day of the delivery arrives and you head to the hospital excited and a little nervous. But at the hospital, the doctor tells you that you need surgery immediately. You cannot give birth naturally. Later, you realize, talking to other mothers and medical professionals, that you were forced into unnecessary C-section. You were not allowed to take an informed choice. What if this happened to you or someone you love? I want you to think about, what would you do as a woman leader or a storyteller or a change maker if you were to find yourself in a situation like this? And let's say your action is aimed at being frustrated about what happened and saying, maybe this should not happen again. Maybe other women need not go through something like this and we have to put an end to it. So you are in many ways also trying to influence a system, a very powerful system out there. So please leave your comments on the chat box. What would be your first 3 steps if this is a situation that you were to find yourself in, and you have to bring some kind of an end to this by influencing a system and a community around you? All right. Awesome. There are comments that are beginning to come in. As a catalyst to motivate women. All right, wonderful. Love that. Nandini says, this happened to me and I never thought about it until much later in my life. All right, Nandini, thank you for sharing that with us. Preeti says, I would feel very angry, frustrated, feel cheated, action, would strongly feel like complaining to the options available. Okay, so we will look at options that are available. I would like to seek to understand why the doctor acted that way. I hope you can sense, some of the emotions in these comments. April says, this actually happened to my sister-in-law, and I am stuck in feelings of anger and hopelessness. April, thank you so much for sharing that with us today. All right, Kizzy says, I would want the doctor to be persecuted. All right, so there is one reaction which is towards the person, towards the doctor, and some of you are looking at more of system level changes, right? Changing the conditions that led the doctor to do this and get away with it. Dr. Deepika has very specific steps: ask the hospital staff, find the responsible doctor. There are more responses that are coming in. Collect other testimonies, critical mass and evidence. Thank you so much, Valentina, for adding that. Viva actually has laid out a few steps. Thank you so much, Viva, for that. File grievance. All right, interesting. And I want you to notice some of these and then go after larger policies within the Ministry of Health. Wow, interesting. Thank you so much, Viva. Marlene says, would feel angry, probably. And I would like to put a formal complaint to the hospital, all right? So the hospital is a system too, so you can see, one of our colleagues said, go behind the ministry, somebody saying, I will go behind the hospital, and then we are going behind the doctor. So very, very interesting responses. Thank you so much. I really appreciate you engaging in this conversation. Definitely feels less lonely on this side. Laura says, I would work to understand every step of how this happened and if it happened to others. Thank you. Priyanka says, I would fetch for ethical justification. All right. Thank you. Wow. I'm just loving this room and the comments that are coming in here. I would rethink back about what my response would have been and the questions I would have asked the doctor to create awareness for other women. Thank you so much, Margaret. Wow. I'm going to read one more comment very quickly. Let's see. Judith talks about, I would seek the doctor to be sanctioned in some way, either through hospital ethics board or a medical licensing board. Interesting. So there are different kinds of systems that we are trying to see and find out if we can influence them. Fantastic. So let me actually take you through what could be potentially, and in many ways, I feel you have forecasted what I'm about to share with you. Let's just say this happens to a lot of women, and we know it does. We know that for a fact, this happens to a lot of women in India. If I was to tell you, if the woman who experienced this started by focusing on research, this is something that a lot of you actually said it, which is you will gather information and data by doing research and gathering stories. This campaigner went on to file a petition in 2016, asking hospitals to make it mandatory to declare the number of cesarean deliveries they were doing. This petition got approximately 400,000 people to sign it. And it became a place where a lot of women also started sharing stories. So you can see that how being able to tell your story as a change maker inspires many more people around us to tell their stories, because then being vulnerable and being able to tell stories becomes normal. Over a period of time, we saw more and more mentions around the cesarean section. And I want you to imagine that this is all happening in a context, in a cultural, social context like India, where it's not really easy for women to talk about these things. So in each of these steps that I'm stating very factually, and it looks very easy, there is a lot of emotions. There is a lot of emotional turmoil that I'm sure all of you can understand. You spoke about influencing systems. In this case, our campaigner might have chosen to influence the Union Minister for Women and Child Development. So that's very interesting. A lot of you got that really right as a step, that you will look for who is it that you have to influence, who do you hold accountable in this process. And finally, the Union Health Ministry did send a directive, and this campaign did find its victory. And even until now, C-section stories continue to have a place in news, and it talks about a lot about women's autonomy and being able to make choices. Thank you so much. You folks in many ways summarize this in your own comments. I love that. And I want you to keep maybe this slide in your mind, and we're going to go, and I'm going to present one more imaginary situation for you. Yeah. If you're ready, please give me a yes in the chat box so I know that you're ready. Not that I'm giving you an option to say no, but I just need you to know. Awesome, great, fantastic. I am going to give you the second situation, and I'd like you to think about what would be your first 3 steps if you were to find yourself or a younger sister or a niece in a situation like this. Here is the situation. Your 14-year-old sister comes home from school upset. She says she doesn't want to go to school anymore. Soon after that, you find out that your neighbor's daughter has also chosen to drop out of the school. She's just 15. You're confused and wonder why so many girls are dropping out. What about their education? You finally speak to them both, realize they're staying home because they can't spend 6 to 8 hours every day without access to a clean toilet. And this gets worse when they are on their periods or menstruating. This is the reality for 27% of girls in the Indian state of Karnataka who were forced to drop out because of the lack of clean toilets. So, Karnataka or Kenya, I like to believe that, you would resonate with this example anywhere. So if this was a real situation, let's say you were experiencing it around yourself, what would be your first 3 steps in this case? Give it a shot. Don't worry about the right answers. Fantastic. I can see that it's already coming in. Thank you so much. Okay. It says, ventilate my sense of frustration. Use change.org. Yes. All right. It's good. It's good. Emotions play a very important role in any change making journey. So fantastic. Thumbs up for that. Sriram says, need the buy-in of parents and teachers. Fantastic. So your influencers, there's parents, there's teachers. Valentina talks about principals. Sriram talks about media. So it's very interesting for me how you've already identified 4 stakeholders that you have to influence. Great. Tell me a little bit more. I want to see a few more comments that are coming in. Josephine says, use data. Absolutely. Thank you so much. So you're going to collect and consolidate data, strengthen your argument. April talks about support my sister to share her experience. Absolutely. So as a change maker, you equip yourself to tell your story, and somebody else right at the opening of the call spoke about a sisterhood, spoke about a network of group that shares similar values. So being able to tell stories and inspire each other for this. Viva says, take pictures of toilets. All right. Collect factual information. Thank you so much, Viva. Go to the social media, stream live. Wow, fantastic. This is getting super interesting. So Sohini says, get these children to tell their own story rather than somebody else. All right. So getting the voices of children who are impacted by this every day. Fantastic. Thank you so much, Sohini. Priyanka says, strengthen sanitation infrastructure. All right. Nandini talks about more data, more stories, working with groups. Louise talks about, great. She's actually shared a link right there for perhaps all of you to read. Thank you so much for that, Louise. Marlene talks about influencing the parent association who can also hold the school management accountable. Fantastic. Karen talks about destigmatizing menstruation. Very important. I think that itself is a game changer. Fantastic. Deborah talks about finding WASH partners and being able to engage with parents and teachers and older students. Fantastic, fantastic. Oh my God. I'm loving these responses. Thank you so much, Jessica, Judith, Preeti, Margaret, Mary, and Valentina and Laura. Thank you so much. I'm going to read the last comment. It talks about sustainable intervention. So there's the fast intervention and there's a sustainable intervention. Thank you so much, everyone, for these fantastic comments. Let me now present to you perhaps what was an actual journey of a campaign like this. All of what you said actually applies, and I'm just putting a sequence to this thought process in the way perhaps this would have happened. Documentation, all of you spoke about data, stories, voices of young girls who were impacted by it. Being able to file a petition. Now, when we're saying petition, I'm not necessarily implying that we are getting attached too much to the change.org petition platform. This could be actually just going online because that is where the world is now, and being able to very specifically focus on the region where you found this issue. And then being able to gather momentum, getting more and more people to look at the issue and engage with it. Find a way to make the story easily relatable so that everyone can resonate with it. Because individual stories, like some of you said, have a lot more power than abstract stories, actually. being able to highlight what are the cascade effects of not having access to toilets, because this isn't just about access to toilets, right? This is also girls' safety. This is also about being able to learn, not dropping out of school. So you're able to really show the ripple effect of a situation like this. And using your social media to actually engage with bureaucrats, because like all of us know by now, some bureaucrats really love engaging and being public heroes. So they want to take public action that everyone gets to see. I'm happy to tell you that this campaign in 2021, the Chief Minister of Karnataka announced 100 crore rupees. 100 crores is 10 crores is 1 million. So that's the equivalent of it. Released a mandate that all toilets and water connections across schools in Karnataka need to be managed well. It created a ripple effect, not just improving education, but also working towards economic empowerment of girls. All right, thank you so much for those fantastic comments that came in. I want to stop here very quickly for just about 5 minutes and understand from you, what are some patterns that you saw in the two stories? Very specifically, what are some common patterns that you saw in the two situations that I shared with you, and all of you already analyzed it? Please send me your comments on the chat box. If you could just name one pattern that you saw that you feel might have enabled these campaigners to bring the change they wanted to bring. All right. Thank you so much. Agency of women, very interesting. Shalini talks about crowdsourcing support. All right. So we're crowdsourcing support, whether it's online or offline. Very exciting. Thank you so much. What are some of the other patterns? Amplifying voices, especially voices of the voiceless, or people who are impacted by it. Evidence-based campaigns, 100%. Use of petition to understand the magnitude of problem, how many others face this scenario. Yeah, absolutely. Taking action when faced with potential consequences and personal risk. Thank you so much, April. That could be like the headline of this entire session. When women set out to bring changes, they are met with resistance at home, out in the world, in the workplace. And some of that resistance can also be risky. There could be many risk factors. Thank you so much, April, for highlighting that. There was a negative outcome that triggered the actions. All right, thank you, Mary. Evidence-based data, power of storytelling, strength in numbers, absolutely. Priyanka, you talk about lack of functional sustainability, okay? Awesome, there's some absolutely fantastic stuff. Great, I wanna read this one. Viva talks about politicizing the issue. Absolutely. So you're going to put a state in poor light, right? Because then the minister's getting anxious about all of this. All right, great. Thank you so much. Leveraging technology online. Perfect. Using storytelling, mobilizing to raise money. Thank you so much, Louise. Great. Thank you so much. So I'm going to leave you with a frame. Just, in case you want to take a screenshot, feel free to do that. And I'm going to quickly walk you through what that framework actually looks like. Basically, everything that you just mentioned. I'm going to let you process what's on your screen. What is common to all of these campaigns that really kind of jolt a very powerful system to initiate changes that are in the interest of citizens, that are in the interest of marginalized communities? There is the sense of appeal, which means, does it resonate? Is it relevant for everybody? It's also very clear. There is this whole thing of being winnable, which means it's very sharp, it has a right target, it has a very strong theory of change. It has emotions, right? I mean, you could see, even if it was a sequence of steps, there were a lot of emotions underneath it. There is a story. There's a story of girls. There's a story of a mother. And there's always a story of power. Who was the powerful one and who is the powerless one? People listen to these stories. You all know and have heard of David and Goliath in that context. Moment, which means the time that you begin to talk about it. Somebody is going to stand for elections. Maybe it's the World Sanitation Day. So there's a timing, there's a moment when you know the media is going to pick it up. It's likely to create a buzz in social media. The reason why we call it OSOMO is just to make it easy for everyone to remember. So you start with appeal, winnability, emotions, story of, and moment. I'm going to request all of you to give this a try at some point and see if this kind of frame helps you a little bit. If you would like to know more about this, you could actually, and you would like to join the She Creates Change cohort. Some of you may not have enough context, but She Creates Change is a flagship program of the Change.org Foundation, and it is aimed at working with women from marginalized communities in Asia, Africa, and Latin America. And we talk about a lot of these things. So it's not just a lot of skills, but a lot of sisterhood, a lot of community, a lot of network. So if you would like to know more about this, or you would like to join perhaps a future cohort, my team member Mary would drop a link in the chat box. Please feel free to leave us your email ID and we'll be happy to send you more information. Great. And just in case you thought these were imaginary situations, I'm sure you guessed it, they were not imaginary situations. I am going to introduce you to the two women who were actually behind these campaigns. The first campaigner around the cesarean section, I can see a lot of people applauding on the camera. Thank you so much, is Suvarna Ghosh. And our second campaigner is Archana. Both of them are joining us from India because I said, you know what, I can't practically run this session without giving you a chance to meet them and introduce them. So I am going to request Archana and Subarna, who are on this call, to just come and join us, on the screen. And Subarna, if you are with us, let me actually try to find a way to spotlight you too. All right, Subarna and Archana, welcome to this call. I'm so glad that you joined. So everyone, these are the two amazing women who are behind this. These are real life stories of two women who did this. In the interest of time, Subarna and Archana, I want to ask you a question, right? Which I asked the group the first time. What was, an enabler for you in being able to tell your story? And what was the first obstacle when you started this journey? So let's go with Archana and then we'll go to Subarna. There's a lot of love coming for both of you in the chat box right now. Thank you so much. Archana, let's go with you. What was an enabler for you in being able to tell your story publicly, and what was an obstacle for you?
Thank you, Shalini. Hello, everyone. Good evening. Shalini, one enabler is my experience as a child. What are the issues I faced by accessing a lack of toilet facilities in my village, and my story. That is the first enabler. The second, that obstacle is making others, making government or making parents or making society to make them understand sanitation is the biggest issue. If you don't have a toilet, it's the issue. Making them to understand it's a problem. So that is my biggest obstacle. Another obstacle is like bring changes in a systemic level and sustainability way. That is the another obstacle.
Thank you so much, Archana, for that. Subarna, tell us about your enabler and your obstacle.
Thank you so much, Shalini. Hello, everybody. I was going through the responses and my enablers and obstacles. I think a lot of them have been mentioned, but quickly, one very important enabler that I felt mattered during the journey of the campaign was the fact that I decided to go back to university, much later in life, just to read about women's movements, about how, different kinds of movements have been built across the world. the whole journey of reproductive justice, how it has unfolded, and the research and the data and how that has driven. Because this, even to learn about it helped me to figure out the strategy of how would I address, because so many solutions were suggested here in the chat box. And I knew that, yes, I wanted to bring change in every aspect, but where do I begin? So I was a little lost on where to begin, because it's the whole system of, the reproductive system, the healthcare system that I was looking at. So just to even find out that I was going to ask for data transparency, basically harp on the theme of accountability in order to ensure that there is better performance. This bridge of the ask I could arrive at because I went back and did my research, read up the Lancet, read up what the World Health Organization said. So that was my enabler. And as far as obstacle is concerned, since this is a meet where we are discussing health, I will definitely want to highlight that the biggest obstacle for somebody who is an ordinary person without a medical degree is the power dynamics that rules the whole equation of the care provider and the care seeker. So as an ordinary woman who all I did was frankly get pregnant and give birth, I did not have a certification to say that, the whole concept of rights-based healthcare is so lacking around us that just another woman who gave birth coming in and asking for accountability may not be received very well always. And it's very easy to be dismissed. So the obstacle was that power dynamics. Thank you so much.
Thank you so much, Archana and Subarna. I'm going to just leave you both with one final question. There's still a lot of comments coming for both of you, a lot of support, a lot of solidarity. Thank you so much, everyone, for all the love that you are extending Archana and Subarna's way. To all the women who are in this group, right, now we know that there's always an obstacle, but then there are also strengths and enablers around us. If you could leave them with one final closing message about being able to initiate their change-making journey, what would be that one message, closing message? Archana, let's go with you first.
One is believe change is possible. And the second is just act to it, don't react to it, and motivate others to bring a change.
Thank you so much. Yeah, bang on. Well said, like always. I want to give quick context. Archana, after winning this campaign, has actually started several campaigns in the state of Karnataka in India. She is currently pursuing her career as an aspiring politician. And this is exactly the kind of women leader we need in the parliament in a country like India. So well done, Archana. Subarna, closing comments and messages.
I think a very, very simple strategy that one can have is, as women, we constantly doubt ourselves. We suffer from various kind of imposter syndromes and, whether we can. So I think it's very important to look around, to kind of find yourself within a community, to reach out, as we share our stories, I think that automatically builds around us. And very, very important during this journey is not to be afraid to reach out for help. We all need to reach out for help. I cannot know it all, and I do not have solutions. I know there is a journey to be made, and I can't do this alone. So it's important to, just to reach out to, ask the person next to you, I don't know this, can you help me with this? So that was something I think we all need to remember.
Thank you so much, Subarna. Thank you so much for those inspiring words. I think in all feminist movements, we talk about the power of sisterhood, right? In the power when women begin to talk to each other, listen to each other, and collaborate and become allies. And I think that's the message that you leave us with. Subarna went on to start an organization called Rewrite. I'm going to request Archana and Subarna to quickly leave your Twitter handles in the chat box so that people can come and find you. I'm sure a lot of people want to talk to you. Thank you so much, everyone, for listening. Thank you so much for joining us today. I had an absolutely fantastic time and loved the comments, your ability to interact and just keep your responses coming in. I'm super grateful to that. And finally, all I want to say is this is actually not so much about a framework. You can see that almost intuitively, you had all the answers. And I think as much as it is about frameworks and factual information, there is so much about honoring your intuition, honoring the wisdom that each one of you have in your leadership capacities. So thank you so much. And I want to congratulate all of you for this absolutely fantastic journey that you're all on. I guess this is the end of it. Thank you so much.
Thank you.